I graduated from Texas A&M University, College of Veterinary Medicine, and when I finished veterinary school, went to Colorado State University for a rotating internship in small animal medicine and surgery, followed by a 3-year residency back at Texas A&M University in neurology and neurosurgery. After I completed my residency, I did spend about 5 years in academia as a professor of neurology and neurosurgery at Auburn University, where I taught students, developed education courses in communication, and also really did a lot of research in stereotactic biopsy and intracranial surgery. And following that, my path led to being in medical leadership, overseeing hospitals as a medical director or multiple hospitals, as a group medical director, followed by coming back to Seven to be Director of Education and Wellness, as well as a neurologist and neurosurgeon here. I think that the most rewarding thing about the field of neurology and neurosurgery is that no matter what we are dealing with, whether it's a patient with seizures, whether it's a case that can't walk, whether it's a vestibular case, everyone is scared and worried when they come in. The patient's scared and worried, the client's scared and worried. And no matter what the outcome, we're gonna find a way to make that better and help. Whether it's helping a patient walk again, whether it's making there be less seizures, whether it's finding the answer. And I find that very rewarding. I love the combination of medicine and surgery in what we do. We don't just do one thing, we do lots of things in neurology. I think that's the other reason why I love it so much. I think one of the wonderful things about Seven is that we take the time to sit down, communicate, and explain what's happening as best we can. And we do that in multiple layers. The doctors do that, the technicians do that, the assistants do that, so that at any touch point, the client has someone who will take the time to let them know what's happening. When our patients are here and hospitalized, our pet parents get pictures and they know what's going on, they get lots of updates, they can reach out to us at any time, and we also update them at every step along the way once a pet is here. So I think that that's a big strong point for us, is our communication and just taking the time to sit down with them. I think the differentiating factor for Seven is that we are solely focused on neurology with a significant number of team members dedicated to your pet. And that's very different from everywhere else I've ever worked. But here we've got a ratio of 8 to 9 people to 1 patient. We are all paying attention, we all care. And I find that a very different experience as a neurologist, where I have all of those people to support me, which then means I have all of those people to support the patient and the client through their journey here.